everyone, welcome to Mom Squad, the parenting show where we go in depth about some of the biggest issues our kids are facing. I'm Maureen Kyle, and today we're talking about the rise in popularity of weight loss drugs, especially for kids who are fighting obesity. In a few minutes, we're going to talk to a doctor from the Cleveland Clinic who sheds a light on what's safe and how treating obesity is an overall health issue for our children. But first, let's take a look at how serious this condition is becoming. Right now in the U.S., obesity rates are rising, affecting nearly 1 in 5 kids ages 2 to 19. Last year, the American Academy of Pediatrics included anti-obesity drugs as part of treatment approved for kids. The drugs are to be used in tandem with diet and exercise, but there are some drawbacks. The drugs are expensive and not always covered by insurance. And some experts believe they need to be taken long term. So we sat down with a doctor who's now prescribing these type of drugs to her young patients and seeing results. Here's our interview with Dr. Lina Al-Khalid, a pediatric endocrinologist and obesity medicine specialist at the Cleveland Clinic's Children's. So weight loss drugs are becoming more and more popular, not just with adults, but we're seeing statistics about teens being treated with these weight loss drugs. Is that something that you are seeing?
Yes, absolutely. So we are seeing more and more actually patients and their families are more aware of the disease of obesity and the impact it has actually on their life, on different aspects actually of their life, complications in the future, and the burden it has. It can cause in the future in terms of like long-term complications.
So these weight loss drugs are beneficial for even at what age would you say is a healthy age that can start these weight loss drugs?
Yes. So for the weight loss medications, definitely there are certain criteria before we go ahead and start these medications. So any patient who comes to us for management for childhood obesity, these patients usually they go through a very comprehensive weight management program, and we usually start with the intensive healthy lifestyle changes, and then certain patients we can see that they actually qualify for the use of these medications. And usually it's for patients who are 12 years and above with the disease of obesity, and make sure that these patients also do not have any contraindication for the use of these medications.
So this has been as we're all learning, I mean, it's just such a hot button topic right now. Every time I turn around, I'm seeing some sort of headline about Ozempic, Wegovy, the generic version. So these have been around a while. I mean, have kids and teens been using these drugs already, and we're just kind of hearing about it as a specific weight loss tool because it's been used with diabetics?
So these were actually approved for diabetes management in adults. There have not been actually approved for use of for diabetes in pediatrics yet.
Okay.
However, the semaglutide has been just approved for the use of for weight management use in pediatrics, just actually as of last year. Wow. For the semaglutide specifically, we're still waiting for the FDA approval for diabetes management. But these medications they've been around for a long period of time. With these, actually, we have the same class of medications. We've been using it for decades now. We're just kind of we're having like numerous generations of these medications with better efficacy. And now it's been used for weight management in adults also for a longer time, and now we're just trying to switch this and actually maybe use it also for management of obesity in pediatrics.
Wow.
Yeah.
So as a parent, my first initial reaction when I see that teens, and I don't have a teen yet, but if I had a teen, I would my first question would be, is this safe? Is this okay? Is there going to be any like long-term effects? Have we really been using it that long that we know that this will help and not harm?
Yes. So these, as I said, these medications been around. They've been around actually for decades now. They've been used for so many, mainly for the indication of diabetes management. We have been using it more in adults also for decades for weight management. So But like again, with any medication, with the use of any medication, a percentage of patients might develop side effects. So that's why it's very important to carefully identify the patients who actually qualify for these medications, learning more about your patient, make sure that there are no contraindications that can cause long-term side effects or implications on health. And again, whenever we are using these medications, we still need to see our patients and monitor them clinically and sometimes even laboratory, like actually just doing a lot of tests long terms and just seeing them more often to make sure that they are not developing these side effects and they're actually responding to the medication appropriately and that no adjustment are needed.
Specifically, can you list what side effects would be possible?
So it depends on the medication. So if we are talking about the semaglutide, all the injectables, generally I would educate my patients about the possibility of having gastrointestinal side effects. So most commonly you might have issues with indigestion, nausea, constipation. These would be like more of the common side effects. There are some maybe very rare side effects that were listed during the research trials, maybe increased risk of pancreatitis, even that's going to be a very, very small percentage of patients and very rare and actually also happen in certain patients. But generally, the main side effects would be gastrointestinal.
I ask because a lot of what I'm hearing, I don't know if it's through social circles or articles and everything else, is that sometimes people right now, because it's become so popular with weight loss, they're not going through a doctor. They're finding them through some sort of other like medical spa or finding other ways to get these medications without consulting a doctor first. That has to be dangerous. Am I right?
Yes, absolutely. This is actually unfortunate because it is a great medication, but however, we are seeing more and more of these compounded forms, which when I say compounded forms, it's basically the semaglutide in addition to other medication or other substance or like maybe vitamins, vitamin B12. We really do not know what's going on, like what is inside the compounded semaglutide. So what I tell my patients that whatever is offered that's not under medical supervision most of the time is not FDA approved or FDA regulated. So we generally actually advise against these using the medications if it's not under a medical supervision.
So guidelines for childhood obesity, we've talked about it before on this show. The guidelines for treating childhood obesity recently changed and shifted. Just remind us again how they changed and what the focus is now.
Yes. So the guidelines now actually, and I would say this is actually a great change and a great step, again, in the management of childhood obesity. They actually highlight the importance of managing childhood obesity at an early age and maybe trying to be more intense and more aggressive actually in management of childhood obesity. It also highlights the evidence that these treatments are safe and effective. And we have now more of like the evidence-based recommendations that when we start this management early on, we actually decrease the risk of developing complications of obesity down the road in adulthood, etc. And usually this starts, as I mentioned, with very intensive and healthy lifestyle changes. Then the next steps actually would be discussing the use of medications for the management of the disease of obesity. And now definitely we are recognizing this more and more as a disease. So it's not just eat less and move more. It's a very complex disease, and management of obesity is going to be also very complex. So we have to target it from different angles. So it's just not lifestyle. Sometimes we do need to use medications for the management of obesity. And in certain patients, also actually there's a need for bariatric surgery or metabolic surgery for weight management. As I said, now with the newer guidelines, we actually, they have recommended that we need to offer medications for patients who need it at the age of 13 years and above. 12 years and above. And for the metabolic surgery, actually, this is offered at the age of 13 years and above.
Wow.
Yes.
So what would qualify somebody as young as 12 or 13 to be considered obese?
Yes. So for someone to actually qualify to be categorized as having the disease of obesity, I would say it usually depends on their BMI or BMI percentile. So for adults, we look at the absolute number of BMI. This is a little bit different when it comes to pediatrics, or because kids are still growing. So we'll be using growth charts where they look at their percentiles in terms of height, weight, and the BMI percentiles. So when we look at their growth chart and their BMI percentile actually is above the 95th percentile, this is what qualifies or puts them in the category of obesity. And then depending on where we are on this growth on this chart as well, it will be developed, can be further actually categorized into class 1, class 2, or class 3 obesity as well.
So a doctor would be able to tell you exactly, because I also, see a trend where somebody thinks, well, I need to lose 20 pounds, and they're seeking out these medications. But is it for people who need to lose 20 pounds or a little weight, or should it be just for the people who could have detrimental health problems? So
again, the amount or to determine whether actually this is a little weight or not also varies, just depending on if you're actually having already complications of the disease. So that actually might qualify you for the use of these medications. So if you have diabetes already, if you have high blood pressure or high cholesterol, so this actually might be indications that we do take into consideration when using these medications. So I would not say that just if you need to lose small amount of weight or a bigger amount of weight, it just actually maybe bring you to a healthier weight where you feel more comfortable and just decrease the risk of the complications down the road.
And we talk a lot about teens' mental health.
Yes.
So addressing obesity, where a child might be facing, would you say depression and some other mental health issues if they are categorized as having obesity as a disease? So does this help in the other aspect with mental health?
Absolutely, actually. So because actually as of any chronic disease, unfortunately with chronic disease, there's always this stigma. With obesity, unfortunately, the stigma is socially accepted. It's actually, we are okay with stigmatizing patients with obesity. So, and this has a huge impact on our patients, especially our adolescents who are growing now, who are actually just going through different phases of life. There's a higher risk of depression, there's a higher risk of anxiety, there's a higher risk of low self-esteem. And again, just because as a society, we have not been very supportive of their mental health or actually their need for management of obesity. So definitely we are seeing a higher percentages or higher risk of depression and even risk of suicidality in these patients. So that's why it's actually very important to manage the disease of obesity at an early age, as I mentioned. And actually just to mention also that the quality of life for patients or adolescents of obesity is actually poorer than the quality of life for children with cancers.
Wow.
So you can see how much impact this actually has on their social or mental health as well.
So when you're saying quality of life, are you talking about social, or are you talking about what does that categorize?
So actually it basically involves a lot of aspects, whether it's actually their mental health, whether it's actually just their daily interactions with their friends, whether even actually I would say unfortunately with other healthcare providers, whether teachers, we all need to be educated that we have to be more empathetic. We have to be more understanding of the disease and just understand what these kids and these adolescents are going through and try to offer the best that we can to help them.
So as a parent who might be watching this and maybe they're wondering if their child does qualify or if their child is almost to that point, what kind of questions should they be asking their pediatrician?
So first off, I would always we have to see whether actually their weight, what are we doing with the weight wise? Are we obesity category? Are we getting closer? Is there any like lifestyle changes that we can start early on just to prevent the progression maybe of the disease? If there are any things that we can modify early on, that would be something to discuss with our pediatricians, where they can offer you a lot of guidelines and guidance about like what are maybe the healthiest way to kind of maintain the weight or prevent further weight gain. And again, without causing any issues with body image actually at the same time, and not causing, avoiding severe calorie restrictions. What happens a lot of times when people actually try to lose weight, which is not healthy. So I would say just discussing this early on with their pediatrician, and at one point, if you think that the weight gain just continues to maybe worsen with time, and now we're developing complications, and hopefully even before developing the complications, just maybe discussing about a referral to a weight management, a comprehensive weight management clinic, where the weight issue can be addressed and managed medically.
Is there anything else? I feel like there's a lot of information that's being thrown out there. Is there anything else that we didn't talk about already that you think that parents and kids should know about some of these weight loss drugs?
Maybe my main message would be just for us, and actually for all of us, just to remember and be very open, and actually know that obesity is a complex disease. It's a complex chronic disease. So we have to manage it the same way we manage diabetes or high blood pressure or like high cholesterol. So we do not have to shy away from using medications. And the use of medications does not mean that you have a lack of willpower or like you actually cannot take control of your life, because this is absolutely wrong. We're trying to avoid any blaming. We're trying to avoid any shaming. And this is absolutely not lack of willpower. This is a disease that needs to be managed like any chronic disease.
Thanks again to Dr. Lina Al-Khalid for taking time to chat with us. And thanks to all of you for joining me here on Mom Squad. We'll see you right back here next week.